Hello my dear learners, myself Bhavani, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In this lecture 22, we are going to cover about the role of RAS and disorders of any kidney. So without any further delay, we will dive into the session. Okay. So, what is an endocrine system? Before going to see about the role or regulation of an RAS, we have to understand about the endocrine regulation. So, there are the several hormones, several important hormones which plays an important role to regulating the kidney function. So, among that there are the two important hormones, one is the renin angiotensin aldosterone system and second one is the antidiuretic hormone. So, these are the two most important hormones which comes under the endocrine regulation. One is the renin angiotensin aldosterone, which you can call as RAS, R-A-A-S, okay. And second one is an antidiuretic hormone. Antidiuretic hormone which you can call as an vasopressin. And from where the antidiuretic hormone will be get liberated or released? It is released from the posterior pituitary. Right, it is so if I am talking about the pituitary, we are having the anterior pituitary and posterior pituitary. Most of the hormones will be released from the anterior pituitary, and the few hormones like oxytocin, vasopressin will be released from the posterior pituitary. So what is an posterior pituitary here? Which hormone is going to release it from the posterior pituitary? Vasopressin. So vasopressin is nothing but antidiuretic hormone. Okay. So the renin angiotensin aldosterone system will plays a very important role in both kidney and cardiovascular system. Okay, so it is a system which will equally maintain, so which will equally balance the both systems like kidney and heart. Okay, so let me see the role of RAS in the kidney. So if I am talking about students RAS, what is a RAS? Renin angiotensin system. So if there is any excess activation of this system, what is going to see here? So if it is, whatever the system in our body will be happens due to because to maintain the homeostasis, right? To maintain the homeostasis, the particular system will be get activated and it will do its work and it will be get inhibited, right? So what is happening when you can see the disorders of particular system when it is not working properly or if it having the excess activation, right? So if I am talking about here, if the RAS has been excess activated, what is going to happen? You definitely are going to see the renal and heart disorders. So which disorders you can see here? Hypertension, congestive heart failure, which you can call as an heart attack, right? And myocardial infarction, atherosclerosis, okay, kidney disorders, you can say the acute kidney disorders, chronic kidney disorders, stroke. So myocardial infarction, all these are the disorders which you can see when there is excess activation of RAS. Okay. So, and what is the role of renin angiotensin aldosterone in the kidney? If the renin angiotensin aldosterone system has been involved, so what is the main role of this system? It have to reabsorb the sodium. It have to reabsorb the sodium into the body and it will regulate the electrolyte balance, it will regulate the fluid balance, it will regulate the blood pressure, right. So, regulate blood pressure in sense if the sodium has been reabsorbed, which may causes the increase in blood pressure, right. And angiotensins, here I am talking about the renin angiotensin. What is an angiotensin? Angiotensin is nothing but it is a peptide and which has been synthesized from the angiotensinogen. So from where the angiotensin will be get synthesized? It is the synthesizer, it is a precursor. Angiotensin is a peptide which are synthesized from the angiotensinogen, and from where angiotensinogen will be get liberated or will be get excreted, and it will be excreted from the, or it will be synthesized from the liver. Okay. Okay. So, if I am talking about here renin angiotensin aldosterone system role, here we are having the four important angiotensins which are named as angiotensin 1, angiotensin 2, angiotensin 3 and angiotensin 4. So, what are all these? These are all the peptides. From where it has been synthesized? It has been synthesized from the angiotensinogen. And where the angiotensinogen will be synthesized? Angiotensinogen will be synthesized in the liver. Okay. And if I am talking about the angiotensin 1, it is an inactive form. It is an decapeptide. Angiotensin 2, it is an active form, no doubt in it. When this angiotensin 2 has been activated, which can causes the vasoconstriction, it is an potent vasoconstrictor. It is an active form, which is an octapeptide. Angiotensin 3, it is an heptapeptide. So, among of all these angiotensin 1, 2, 3, 4, the 2 will plays a very important role in the maintaining of blood pressure. So, we will discuss in the upcoming slides here. Okay, when the renal blood flow decreases, what is going to happen? The extraglomerular cells in the kidney, okay, when the renal flow has been decreased. For example, students, the renin, angiotensin, aldosterone क्या करता है? It have to maintain the homeostasis, right? If you just imagine, अगर renal blood flow decrease हो गया body में, then what the system will do? If the renal blood flow has been decreased, the system will be get activated and it will, what it will do here, the juxtaglomerular cells in the kidney. So ये cells कहाँ पर present होता है? Kidney में present होता है. Juxtaglomerular cells in the kidney converts pre-renin to renin. So आपका renin कहाँ से release होता है? The renin will be released from the kidney. Angiotensinogen will be released from the liver, okay, and when the renal blood flow has been decreased, the juxtaglomerular cells in the kidney, it will convert pro-renin to the renin, and with the help of renin, the angiotensinogen will be converted into angiotensin 1, which is an inactive form, no doubt in it, and after of that, it will be converted into angiotensin 2 in the presence of angiotensin converting enzyme. So, which I had shortly represent as ACE. So, what is an ACE? Angiotensin converting enzyme. It is an enzyme which will helps to convert the angiotensin 1 to angiotensin 2. And next, angiotensin 2 will be converted into the angiotensin 3 and angiotensin 4 in the presence of aminopeptidase. Okay. So, here you have to remember the two enzymes. One enzyme is angiotensin converting enzyme which helps to convert angiotensin 1 to angiotensin 2. Okay. And the second one is aminopeptidase which helps to convert angiotensin 2 to the further forms angiotensin 3 and angiotensin 4. Okay. So, students, I think by this flow chart you will get very clear and how the renin, angiotensin, aldosterone system will plays a very important role in the kidney. So, let us discuss here angiotensinogen. Okay. So, angiotensinogen, from the previous slide I am saying you the angiotensinogen which will be synthesized from the liver. Okay. So, when the angiotensinogen has been synthesized from the liver, it will be interact with the renin and the presence of renin. So, angiotensin, when the angiotensin has been released from the kidney, okay, so where the angiotensinogen will be get synthesized, this angiotensinogen will be synthesized in the liver and it will be combined with renin. And how the renin is going to form? The juxtaglomerular cells in the kidney will help the pro-renin to convert the renin, right? Here the renin आपका form हो चुका है and with the help of this renin, angiotensinogen will be converted into angiotensin 1, okay. Without renin, there is no conversion of angiotensinogen to angiotensin 1. This is the first point, okay. So, to produce the renin, the juxtaglomerular cells will be initiated, okay. So, when the angiotensinogen in the presence of renin, it will be converted into angiotensin 1, okay. And once angiotensin 1 has been produced, it is in a peptide form, it is an inactive. In the presence of ACE inhibitor, ACE, angiotensin converting enzymes, so it will be converted into angiotensin 2. And when the angiotensin 2 has been converted, it is in a very active form and the presence of aminopeptidase, it is going to convert it into the angiotensin 3 and further aminopeptidase enzyme से आपका angiotensin 4 liberate होता है. And here if I am talking about this angiotensin 2, here this is plays a very important role. This angiotensin 2 is an active form. What is going to happen? And this angiotensin, जब आपका angiotensin 2 synthesized हो गई, liberate हो गई, then आपका angiotensin receptor में जाके bind होता है and when this angiotensin binds to the angiotensin receptor, what is going to happen? Vasoconstriction, and when the vasoconstriction is seen, we can definitely it will increase in the blood pressure. And second one, when the angiotensin has been released, it will go and bind to the adrenal cortex. So, adrenal cortex, what is an adrenal cortex? It is an aldosterone, it is a corticosteroid, right? It is a steroid, adrenal cortex, it is a steroid. Aldosterone is a steroid, right? So, adrenal cortex से आपका aldosterone secrete होता है. कब secrete होता है आपका aldosterone? Aldosterone कब secrete होता है? जब आपका angiotensin active form में होगा. And in the adrenal cortex, आपका adrenal cortex से आपका aldosterone secretion होता है. जब भी आपका aldosterone secrete होगा, sodium and water retain होता है. And when the sodium and water retain, you had seen what is going to happen? Increase the blood volume. And where you can see the increased in the blood volume and what is going to happen? blood pressure also automatically will be get increased. So, this is about the overall flow chart of an renin-angiotensin system. So, these are the few points you have to remember here. We are having the 4 peptides which are named as angiotensin 1, 2, 3 and 4. So, among this the 2 will place a very important role here, which is an angiotensin 2. Okay. To produce the angiotensin 2, which enzyme is going to help? Angiotensin converting enzyme. Okay. This enzyme will helps to convert the angiotensin 1 to angiotensin 2. And how the angiotensin 1 is going to form? Angiotensin 1 is going to form with the help of renin. Okay. Angiotensinogen, with the help of renin you can produce the angiotensin 1. From angiotensin 1 say angiotensin 2 in the presence of ACE, and from angiotensin 2 say you can produce the angiotensin 3, angiotensin 4 in the presence of aminopeptidase. Okay. And if I am talking about this angiotensin 2 can go and binds to the angiotensin receptor. So, when it binds to the angiotensin receptor, what is going to happen? The receptor will be get activated and causes the vasoconstriction. When the vessel has been constricted, the blood pressure will be going to increase. And second one, what is going to happen here? When the angiotensin 2 has been active, then the aldosterone will be get secreted from the adrenal cortex. कहाँ से आपका aldosterone secrete होता है? Aldosterone आपका adrenal cortex से secrete होता है. And this aldosterone, you know that aldosterone is an sodium water retain करता है. जब भी आपका ये जो secrete होता है aldosterone आपका body में secrete होता है, इसका काम क्या है? सोडियम का reabsorb करना है, सोडियम का retain करना है body के अंदर. So obviously when the sodium has been retained into the body, automatically the blood pressure will be get increased, right? Okay. And these are all the roles which I have discussed in my previous slides. First of all, when the renin-angiotensin system has been activated, increase the blood pressure, it will increases the force of contraction. Okay, when it has been stimulated, when this renin-angiotensin stimulation has been activated, it will stimulate the sympathetic system also. You know that sympathetic system जब भी आपका activate होता है ना, blood pressure increase हो जाएगा, because sympathetic system will causes the vasoconstriction. Okay, and not only the vessel, it can having capability to constrict the muscle also. Okay, smooth muscle. Okay, and it having capability to synthesize the aldosterone, which I had said you, adrenal cortex से आपका aldosterone secretion का भी मदद करता है, and this aldosterone will plays an important role in reabsorption of sodium. Okay, and this RAS will plays a very important role definitely to maintaining the electrolyte balance. Okay, so next we will enter into the diseases of kidney. So this is the final part of your this unit. So by this conclusion we can end the unit. Okay. So the disease, what are the diseases of the kidney? First we will go with the glomerulonephritis. So what is a glomerulonephritis, which you can shortly named as GN? Okay. Glomerulonephritis, which you can shortly named as GN. What it is? It is an inflammatory condition of an glomerulus. So don't get confused here students, glomerulus, glomerular capsule or Bowman's capsule. Glomerulus is nothing but network. It is a nothing but, it is a capillary network. Okay. So what is going to happen? The glomerulus, it is an inflammatory condition of an glomerulus. So glomerulus का inflammatory condition का आपने glomerulonephritis कहता है. So how many types होता है? हाँ, कितना types है glomerulonephritis? So glomerulonephritis is of mainly 4 types. What are they? Diffuse proliferative glomerulonephritis, focal proliferative glomerulonephritis, and third one is membraneous glomerulonephritis, and last one is minimal change GN. Okay. So these are the 4 types. One is the diffuse proliferative, second one is the focal proliferative, third one is the membraneous, and fourth one is the minimal change glomerulonephritis. So beta हर glomerulonephritis में common features है hematuria, proteinemia. So what is an hematuria? What is an so if I am seeing here the hematuria, proteinemia, hematuria, proteinemia. Okay, these are all the common features of an glomerulonephritis. So proteinuria. So if the excess of protein has been eliminated from the urine, if you are seeing the excess of protein in the urine, you can call as a proteinuria. If you are seeing the blood in the urine, you can call as an hematuria. So simple, heme. What is meant by heme? Heme is nothing but blood. Urea, urine. So when you can see blood in the urine, you can call as an hematuria. When there is excess of protein in the urine, you can call as an proteinuria. Okay, what is an acute nephritis? It is an inflammatory condition of any kidney, acute nephritis. So what is a nephritic syndrome? What is the main causes? So acute nephritis just we had discussed. So so these are the two features of the first two types, and the nephrotic syndrome are the features of the second two types. Okay. So the common features है students, जो glomerulonephritis को common features है हर glomerulonephritis में. So if I am talking about the nephrotic syndrome, this is due to because of the trachycardia, जो यहाँ पर आपका स्किन कलर चेंज हो जाता है, हाइपरलिपिडीमिया कॉज होता है. ओके, सो ऑल दिस आर द चेंजेस यू कैन सी विद द नेफ्राइटिक सिंड्रोम. ओके, नेफ्राइटिक सिंड्रोम इज नथिंग बट द ग्लोमेरुलोनेफ्राइटिस. ओके, so nephritic syndrome we will discuss here in detail what is a nephritic syndrome. So the glomerular damage, when the glomerular has been damaged. So just we had discussed the glomerulonephritis is an inflamed condition of an kidney, right? When this glomerular has been damaged, what is going to happen? The whatever the proteins or whatever the fats will be plasma, जो proteins है plasma filtrate will be passed into the filtrate, and what is going to happen? Reduces the plasma osmotic pressure. When the plasma proteins and fats in the filtrate, when it is present in the filtrate, then what is going to happen? Here the plasma osmotic pressure will be get decreased. When the plasma osmotic pressure has been decreased, what is going to happen? Edema, inflammation. When you can see the edema, what is going to happen? Next one, reduces the renal blood flow. When you can see the condition, when you can see the when the आपका osmotic pressure decrease हो जाएगा, edema produce होता है. जब edema produce होगा, आपका renal blood flow decrease होता है. renal blood flow decrease हो गया, renin secrete होता है. renin जब secrete होगा, क्या होता है आपका? angiotensin 1 से आपका angiotensin 2 liberate होता है. angiotensin 2 is a protein vasoconstrictor, and it also having capability to release the aldosterone from the adrenal cortex, and this aldosterone which having capacity to reabsorb the sodium. So what is going to happen here? The renin secrete होने की वजह से आपका reabsorption of water and salt is going to happen. जब भी आपका reabsorption of water and salt is going to happen, again which is connected to the plasma osmotic pressure will be get decreased. So this is about the nephritic syndrome. Simple students, the when the kidney has been damaged, so आपको normally just सोचो हमारे हर organ का एक role होता है, right? Right, respiratory system का role क्या है? So we have to inhale or you have to exhale, right? In a such a way, the kidney also having the important role. What is the main function of a kidney? It have to filter the lot of things in the body, right? It have to send the excrete, it have to send the toxic substances from the body, it have to send the most of the waste products from the body, right? So when this kidney has been damaged, the lot of the plasma proteins and fats will be entered into the filtrate, and what is going to happen here? The osmotic pressure will be get decreased, which can causes the edema. And जब भी आपका edema हो जाएगा ना, एकदम क्या होता है, आपका renal blood flow decrease होता है, and to maintain the homeostasis आपका renal blood flow decrease होने की वजह से क्या होता है, आपका renin secrete होता है. जब भी आपका renin secrete होता है, renin की वजह से आपका angiotensin 1 बनता है in the presence of angiotensinogen. In the presence of renin आपका angiotensin 1 बनता है, and from the angiotensin 1 से आपका angiotensin 2 बनता है, and 2 is an important thing which can causes the increase in blood pressure by contraction the vessel, and it can causes the secretion of aldosterone by acting on the adrenal cortex, right? So this is called as a nephrotic syndrome. So these are all the symptoms like trachycardia, edema, pale skin, hyperlipidemia, proteinuria, protein in the urine, okay, vomiting. So these are all the symptoms of a nephritic syndrome. Okay, so what is a diabetic kidney? This is the second disorder. First we had discussed about the first we had discussed about the GN, glomerulonephritis. Okay, so we had completed this one, glomerulonephritis, and now we are entering into the second one, diabetic kidney. So the most of the death is due to because of any diabetes. So जिसका diabetes है उसका अगर kidney का problem है तो definitely the most of the deaths was happening due to because of this only. There is no doubt in it. And if I am talking about the diabetes, we are having the two types of diabetes. One is diabetes mellitus and second one is the diabetes insipidus. So the diabetes insipidus से जो death है थोड़ा कम है compared to that of diabetes mellitus, those who are completely insulin dependent. Okay, so those who are completely insulin dependent, the renal failure is one of the important cause for the 50% of डायबिटिक पेशेंट. जिसका डायबिटीज़ है बेटा, उसका अगर रीनल फंक्शन नहीं हो पा रहा है, रीनल जो किडनी सही से काम नहीं कर पा रहे, देन व्हाट इज गोइंग टू हैपन? द डेथ विल बी occurred. Okay, the most 50% of cases of diabetes is due to because of renal failure, due to because of the kidney is not functioning in the body. When the kidney will be get failed, the diabetes will be get or worsen, and which can causes the death also. So if I am talking about here, there is a damage. What is going to happen in the diabetic kidney? Here what is the large vessels, here small vessels, whatever it may be, which is going to damage and which causes the atrophy of the tubules, okay, and which causes the acute Phylonephritis, okay, which causes the erythroma. Erythroma, what is meant by erythroma? Fatty deposition or forming of plaque inside the arteries. So it is called as an atheroma. So these are all the nephrotic syndrome is also one of the cause in the thing. Okay. Next one was hypertension. So the next disorder, so we had discussed about the GN and we had discussed about the diabetic kidney. जिसका diabetes है, अगर उसका renal failure हो गए, तो most of the cases death was due to because of, in a such occasion, those person who having the diabetes with the impaired kidney function. Okay. And next third disorder was hypertension. So you had here hypertension, the most, हर घर में जो हर family में जो एक hypertensive patient भी होता है, including me, right? So everyone, even not, it's not matter about the age also, due to because of stress also the hypertension will be get arised, right? So that no, किसका टेंशन नहीं होता है बेटा, सब आपको पढ़ने में टेंशन होता है, हम जॉब में भागने के लिए टेंशन होता है, हर चीज़ का टेंशन होता है. So which can leads to stress. The most important role of a heart disorder is due to because of a stress, no doubt in it. So the hypertension, what is mean hypertension? If there is increased, elevated blood pressure, you can termed as an hypertension, right? So hypertension क्या होता है बेटा? When if I am talking about this hypertension, this is of mainly two types. Primary hypertension होता है, secondary hypertension होता है. Primary hypertension was the most common hypertension, but इसका cause पता नहीं होता है. There is no known cause behind the primary hypertension, and the secondary hypertension, it is rare, it is not much more common, and इसका cause पता होता है due to because of thyroid problem, due to because of any other problem, जो kidney problem, उसकी वजह से आपका hypertension होता है. And the primary hypertension you can call as an essential hypertension also. Okay, we having the two hypertensions, we having two types of hypertension. One is essential hypertension and second one is the secondary hypertension. Essential hypertension you can call as a primary hypertension, and this is a secondary hypertension. Okay, primary hypertension का cause आपका पता नहीं होता है, secondary hypertension का cause तो आपका जानता है. The most common primary hypertension was essential hypertension. Okay. And next one, renal calculi. So what is a renal calculi? It is nothing but is a kidney stone. When the kidney stones has been formed, you can call as a renal calculi. So renal calculi is nothing but any kidney stones. Here the stones has been classified into the calcium oxalate, calcium phosphate, ureates, uric acid stones. ये सब कुछ होता है बेटा. So if I am talking about the renal calculi, there are two types of pain. So जिसका renal calculi होता है ना, उसका दो types of pain होता है. One is the renal colic pain, which is an acute, and second one is the non-renal colic pain, which is an mild to severe. So what you have to go with here, जो जिसका renal calculi, जिसका kidney में stones है, what we have to do here? We have to first you have to remove the stones, because kidney में तो stones है. तो आपको स्टोन्स का रिमूव करना पड़ता है, और यू हैव टू गिव द लिक्विड इनटेक मोर टू द पर्टिकुलर पर्सन, और यू हैव टू डिक्रीज, व्हाट यू हैव टू डिक्रीज हियर, you have to decrease the food which causes the stone formation. Okay, जो जिस food आपका stone formation को cause कर सकता है, वो food का आपने reduce करना पड़ता है. This was the treatment for the renal calculi. And next we will go with the uremia syndrome. So what is an uremia? So urea is a chief excretory product in the human beings. जो urea आपका जो excretory product है, right? So if in generally if I am talking about urea found in the urine, but sometimes the quantity will be eliminated in the blood also, right? So आपका यूरिया कहाँ पर होता है, आपका यूरिन से एलिमिनेट होता है. समटाइम्स क्या होता है ना, आपका जो यूरिया है आपका ब्लड में भी ज़्यादा लेवल्स एलिवेट हो जाता है, एंड इन सिंपली यू कैन कॉल यूरीमिया. You can when you can go with the Google search, you can they will give you that uremia, increase urea in the urine or urine in the blood. Okay, so urea in the blood is simply termed as uremia. So just see uremia, uremia. Where here? Uremia. Urine hemia. Hemia, what is mean by hemia? Hemia is nothing but blood, urine plus blood. So urine अगर आपका blood में है तो then you can call as an uremia. Urine in the blood simply you can termed as uremia. In such a condition, what is going to happen when the urine in the blood, when the urea or urea in the blood, what is going to happen here? The kidney will going to failure, the renal function is going to collapse. So what you have to do here? You have to go with the treatment, you have to give the medications, or you can follow with the dialysis, or you can go with the kidney transplantation. Okay, next one is polycystic kidney syndrome. So what is a polycystic kidney syndrome, or what is a polycystic kidney disease? So it is one of the disease, it is one of the important disease which falls under the kidney disorder. Okay, it is due to because of a heredity conditions. Okay, so if you see here these two pictures, this is a normal kidney, this is a polycystic kidney. जो polycystic kidney में क्या होता है? This the fluid sacs. Right, you are seeing here, this is the fluid sacs. Filled fluid sacs are called as a polycystic kidney. Okay. So what is going to happen here? The growth of the cyst causes in the kidney to become enlarged. जो यह kidney थोड़े से enlarge होता है क्योंकि cyst बन गए. So growth of the cyst causes the kidney to become enlarged, and which will causes the kidney failure. Okay. So here the two major forms होता है polycystic kidney disease का. One is autosomal dominant form, second one is autosomal recessive form. So these are the two forms for the, what is this? Two forms for the polycystic kidney disease. One is the dominant form, second one is the recessive form. Okay, next one is renal failure. Renal failure was one of the most important kidney disorder. So बेटे यहाँ पर क्या होता है, जब भी आपका किडनी फेल होता है ना तो टॉक्सिक सब्सटेंस का एलिमिनेट करने मुश्किल पड़ेगा, राइट. सो व्हेन द किडनी हैज बीन फेल्ड, देन द किडनी कैन नॉट एलिमिनेट द टॉक्सिक सब्सटेंसेस फ्रॉम द बॉडी, एंड विच कैन कॉजेस हार्म इनसाइड द बॉडी. सो ऑब्वियसली व्हेन द बॉडी इज नॉट एबल टू सेंड द टॉक्सिक सब्सटेंसेस, यू कैन टर्म्ड एज एन renal failure. So क्या होता है in the renal failure, what is going to happen here? The actually what is going to happen here, the nephrons present inside the kidney will going to damage, right. The most frequent cause of kidney failure was diabetes, and second one was hypertension. So these are the most important causes to fail the kidney. Okay, so you know that the kidney failure will be not happen through overnight. It will be happen due to because of many circumstances. If I am talking about the two types of the kidney failure, one is the acute, second one is the chronic. So we having the two types of the kidney failure. One is acute, second one is the chronic. Acute is a sudden, chronic is an overtime failure. Okay, so what is going to happen in acute renal failure? So this is type of a kidney failure occurs temporarily. It is often temporarily. Okay, causes क्या होता है? Autoimmune kidney disorders, some medications, or if you are having excessive dehydration or any urinary tract obstruction, which can causes the acute renal failure. And what about the chronic renal failure? It is defined when there is a damage or decrease the glomerular filtration rate to send any toxic substances from the body, or where you have to need the replacement therapy, can called as a chronic renal failure. This is all about the disorders of a kidney. Thank you so much. By here we had completed this unit.